We have, yeah.
Hello, bonjour, hola, and assalamu alaikum everyone, and welcome to today's session, Beyond the Pills, which is the first of a series where we will be bringing you the global perspective from pharmacists battling this COVID pandemic around the world. This is going to be a unique session in terms that it will be moderated, chaired, and participated by all the pharmacists from 5 different countries on 4 different continents. So allow me to say welcome to all the respected speakers from all these different countries. It's 5 a.m. in Bogota, Colombia, 6 a.m. in Toronto, noon here in France, and 3 p.m. in Pakistan. I am Farooq Malik, and I'll be your moderator for the session, as we have some amazing pharmacists to share their perspective, and will be highlighting the role of pharmacists battling the ongoing pandemic along with the other healthcare professionals. Just to give you a heads up, a recorded version of this session will be available on Facebook page as soon as we finish here. We'd love to hear from you, as your questions will shape a better understanding of the current situation. For those of you who have just joined us, welcome to this exciting session. Now, as we all know, this pandemic, which started in early December according to a Lancet study, has now been identified in more than 210 countries. It has affected at least 180,000 deaths. Now, all of these numbers that I've just given it to you, they still are an understatement, because as we know from different studies, that there are many more who have been infected so far, and maybe there have been a lot of unrecorded deaths as well. And as the Director General of WHO said the other day, the worst is yet to come. Now, I want to thank the organizers for giving us this opportunity to share our opinions from different parts of the world. To open the session, we are honored to have Mr. Abdul Latif Sheikh, who's going to be the session chair today. He's a veteran pharmacist and a key opinion leader in pharmacy. To give you a brief introduction, he is a registered pharmacist with the New York State Board of Pharmacy and also holds a master's in pharmacy administration from Long Island University of New York. He's the president of Pakistan Society of Health System Pharmacists. He's also the president of Emro region for FIP. He's a member of Prime Minister's Task for Health in Pakistan, and first ever Asian and Pakistani pharmacist who was awarded the most prestigious ASHP Donald Frankie Medal in the year 2018.
All right, as Farooq said, I'm Abdul Latif Sheikh. I'm currently placed in Pakistan. I'm very grateful to Farooq for a very generous introduction, although I basically find it very, very humbling. I think it's a privilege, you know, to be a pharmacist under the current circumstances. And we have, at this moment right now, we have a privilege of having a pharmacist colleague from all over the world. So I was referring to the privilege of having a pharmacist colleague from every corner of the globe. I think COVID-19 has brought forward a lot of challenges, issues, and I think the pharmacists at present or in the future, they probably will have one of the most learning experience out of these episodes which we're having globally. So I think I'm going to pass it on, you know, to Farooq to, you know, start going through the speakers, and what the intent is, we'll find out how our frontline pharmacists handling this COVID-19 pandemic in each region. You see, we have such a listener at the end of the session. Hopefully they will give, they should be able to grasp, or they should be able to gauge a holistic approach how worldwide this COVID-19 pandemic has been handled. And then I think I anticipate on my personal level, and I anticipate it is going to be an exhilarating experience for the pharmacists to listen to our speakers from all over the world. Over to you, Farooq. You please take it from that point on, and you can start bringing in the speakers. Thank you.
Considered as world's best healthcare system according to a WHO report in 2000, is faring its severest test ever in handling the current pandemic situation. France spends more on health compared to enforced its confinement when the number was about 800. But still, France actually has been struggling to deal with this current situation. The role of the frontline fighters, that includes the physicians, nurses, pharmacists, and other healthcare professionals, have been appreciated at the highest level. Just for example, the President of the Republic mentioned all of these different professionals in his last televised speech. The role of community pharmacies who remained open during the lockdown, and the lockdown is actually is quite a strict one in France at the moment, because they started gradually and now it's quite strict in terms of what's open and what's not open. The community pharmacies has played a very important role in raising awareness for both pharmaceutical and non-pharmaceutical interventions. Pharmacists have been at the forefront. They've been contributing in many ways. Just to give you an example, the most talked about COVID study on hydroxychloroquine and azithromycin had pharmacists as co-authors in that study. The pharmacist that actually co-authored in this study is Stephen Honor, someone who's the president of the French Society of Clinical Pharmacy. Now, the problems that France has experienced during this pandemic, apart from its unpreparedness, as admitted by the president, is medicine shortages. So, for example, when in the third week of the epidemic, the local epidemic, the virus hit the old age homes. There were considerable amount of reports which showed that morphine and drugs like midazolam were not available, and there were extreme shortages. Now, PPE shortages were also something that was noted when it all started in the beginning, but now it has all kind of stabilized a bit. We hope at the moment that by the end of July, the nightmare situation will improve considerably. Now, I'd like to now bring in Mr. Hamad Sayed from Canada.
We came up with the Team A, Team B approach in the pharmacy, where a Team A will work a different shift than the Team B. They will not overlap with each other, and so that we can, if someone get tested positive, which has happened in some of our pharmacies, at least we have half the staff which will be able to take care of our patient, which is obviously the ultimate goal, as pharmacists are the frontline healthcare professional and and the most accessible and trusted professionals in Canada. So it's extremely important for community pharmacies to stay open and operational at this pandemic time. We were able to act quickly, and we installed plexiglasses or barrier inside our pharmacy at each contact point, whether it was a drop-off window where the prescription are coming in, whether the counseling or the cash register. So that way we give this reassurance to not only to our employees who are working and helping us at this time, but also to our member, that when they are coming to the pharmacy, there is a barrier there to protect them as well as protect us. The question number two, where the shortages of medication, delivery, the logistic part, where everyone was experiencing similar challenges, whether it was manufacturer, whether it's a wholesaler or frontline pharmacy, pretty much everyone was experiencing shortage of staff, more demand. I myself worked in a number of pharmacy during that time, and definitely the demand went up exponentially. So some of the other things which we are only doing as an essential need is injections. Obviously, as you know that for injections, you have to be in very close contact with the patient. We are still offering it, but we're only offering it if it's extremely essential and urgently needed. We have put on hold on that. But otherwise, the pharmacists are playing a very, very important role. And we are getting lots of questions, queries from our community. I'm very, very proud of our pharmacist community that they are able to handle this in a very professional way.
Right. Thank you very much for your comprehensive, response to all the three questions. And yes, there are a lot of different issues I think that you've just highlighted, and they probably would continue with some of our other speakers as well. So let me just put in Dr. Angela Caro here from Colombia. She is a PharmD. She has a master's in pharmaceutical care and a master's in education. She's a pharmacist, an epidemiologist, and a healthcare leader. But most importantly, she's the president of Colombian Pharmacovigilance Association and has over 15 years experience in medicine. Now, I've got two questions for you, Angela, and obviously you can expand on them and answer them as you like. Focusing on the Latin American setting in general, and in Colombia in particular, how pharmacists have contributed to the handling of this pandemic there. And also, with all these different multiple controversies, with different treatment options being floated out, and I've earlier talked about, the French study, the most talked about COVID study of hydroxychloroquine and azithromycin. How the Colombian Pharmacovigilance Association has helped the Colombian Health Ministry or health community in synthesizing, summarizing, and consolidating any evidence.
Hello. It's a real pleasure to be here. Thanks so much for your invitation and for all of the group. Thank you so much. We in Colombia, okay, maybe just for give you some context, we have in this moment near to 200 of people dead about COVID, and we have 4,000 people infected in this moment, and has the half of the cases of these people, and we are a city. It is for 8 million people here, and this is the capital of Colombia, and this is a centric point of Latin America. And I have in my mind 3 different pharmacists, and in Colombia we have a big problem about community pharmacists because we have some pharmacists that they are inside of the health system, but we have a lot of drugstores that are not inside of the health system, and they don't have pharmacists in there. And this is a big problem for us in public health, in mainly to having all the medication and all the medical devices that we need. Okay. And the last group of pharmacists that I consider is the people in the associations. I will be explain it very good later. But okay, for the first group, to the pharmacist community, we have the same problems that everyone said about protections of personal protection elements, and we have a big problem about the culture of the people, because here is very difficult to have this real isolation between people. The drugstores are open right now. It is the same. They need to continue working, but the drugstores that are not included in the health system don't have this conscious about what is the situation. The people who is working there, it is not professional, and they don't understand very good what is happening. The other group, the group who is working in the health system, is all very more is more understanding all the problem, and they know that it's very important to have that isolation. They are working so hard. I know a lot of companies that are doing a good education to his workers about how treat the patients, but we are not so organized, probably is the word, to have this contact with the patients or with the people they are attending. In the hospital pharmacist, I think it's a very good organized group. We had an association about pharmacists in hospitals, and it works very good. They have all the information very clear. It's so easy to communicate, and they are working every day trying to identify what is the medication and how had enough stock to attend all the patients. But finally, the point that I can explain very good, and I am not sure if I can share my screen, Farouk, please. It's is the point of the associations.
Yes, yes, of course, you can share your screen.
Thank you so much. Are you seeing my screen now?
Yes, we can see it.
Okay, thank you. And then if I talk about the associations, we are, as Pharmacovigilance Association, we have a lot of experience about the information that we need to give to the people here in Colombia. And we are something like a referent in Latin America about medication safe use. We are working with other associations. Initially, we are not just pharmacists association, we are an association who work with physicians, nurses, bacteriologists, but we talk always about medication safe use. And our role in this, we take a decision. We can't do, all the people can do everything. We need to have different work for everyone. And our role, like Pharmacovigilance Association, is to read and to write. That's all. We need to review all the information that is in this moment, because it's a lot of information. And we work with different associations too. We have a very good relationship with the Pharmacist Hospital Association in Colombia. And we work with them with a lot of more associations in producing information. Initially, for example, the protocols of treatment of the patients in Colombia was writing for a group of experts for the Infectology Colombian Association. We work with them and review the treatment that was more appropriate for the patients. We give our eval, we check about. And this is just one example. And the other examples are, we have a group of experts, of pharmacists, physicians, and organize all this information for all the groups, for all the other associations, and for the public, general public. And I want to show you what of these infographics that we prepared. For example, when all that this is start in March for us, we designed some pieces in infographics about don't take antibiotics, because that's a very big problem here. When you said infection, all the people go to the drugstore to have antibiotics, and of course we know that it will be happen. And then just in the start we designed that, talking about this, don't use antibiotic. And for example, storage, the people is trying to have in their homes all the drugs that they can. That's a very big problem for us, because the patient that really needed the medication can't have it. And as I told you before, in the community drugstores, the people can buy a lot of medication without prescription because we don't have professional people there, and it's a very big problem for us. We talk about the other things that the WHO were talking in that moment. For example, the hypertension and diabetes change of treatments and how manage that. And we talk, for example, about the wash hands, and all of this is a typical information how use everything, the personal protect elements. This is one of that pieces. The other piece that we did is this about toxics or intoxications about medication or other products, chemical products. And because we detect that we have a big problem with this intoxication about drugs, because the people are more at home and they are doing the cleaning all the time and using this chemical substance, and it was a big problem for kids at home. And the last one that I want to share with you is, as you are doing in this moment, we had some different projects in the same way, talking about how to work as a pharmacist. In this webinar that we did before, we included one nurse who explained us to all the pharmacists and all the community of pharmacovigilance what is COVID and how we can work about this pandemic, and two pharmacists. And we talk about how to be responsible with the medication and in these times, and how contribute with this medication safe use. Yeah, all of us, our information was shared with the ministry, and we in this moment we have a lot of roles with the ministry, but mainly we have this one to contribute with information for the public, general public, and the other one was, for example, to contact some industries who works, for example, producing alcohol, hell alcohol for the washing hands, and who was the people can produce and usually don't produce it, for example, cosmetic industry. And and we recollect all the information for the ministry, because the ministry, of course, is very, very hard working in other things, and this is very operational thing that we can do. And for example, we help with some changes of laws, because a lot of laws in Colombia are very restrictive, for example, in receiving medication for other countries or another products, and we give our opinion about this. And finally, the other action that I consider is very important for pharmacists is the investigation. I am in this moment the director of career of pharmacy in the Pontificia Universidad Javeriana, and they have a very good group of investigation, molecular investigation about medicines, and they did a molecular modeling about other medication can help in the treatment of the COVID, and we participate there talking about the medication safe use and how these possible moleculars can affect the people in safety and toxicity. I think it's a very abstract resume about what we are working. Thank you, Farouk.
Thank you very much for sharing, all the work that the pharmacists are carrying out in different capacities within Colombia. Yeah, it's quite exciting to hear that the National Pharmacovigilance Association has taken the lead in producing the communications for the Health Ministry on many important topics, which probably would be ignored in the time of this pandemic all around the world. But we need to consider them and continue to remind ourselves and our patients that, problems like antibiotic resistance and viral resistance is something that we need to be very careful about. So thank you very much again. I'd now like to move on to Shweb, and then we'll come back again, see if it's possible to connect with them again.
Hello, everyone. My name is Mohammed Shoaib Khan, right? And I've been working in this community pharmacy in UK since 2007, so 13 years of experience of working in community pharmacy and working as a superintendent pharmacist.
Is there any unusual rise in the demand of medications like hydroxychloroquine and azithromycin once it was purported to be a possible treatment of COVID? So did you observe an influx of newer prescriptions for these medications? And also, if you could share, were there any specific shortages of medicine? And thirdly, was there any specific difference between the role of pharmacists and the healthcare professionals, in your opinion, during the pandemic, right from the outset all the way down to where we are at the moment?
Right. Thank you very much, Farooq. Let me start from, from the background of the situation, when it was declared or when it was initially declared as pandemic, because as everybody might be aware that the UK government was totally confused what to do in that situation, because they were not even closing down the schools. They were really confused whether they need to do the lockdown or they need to go for the herd immunity. They were talking about so many different things, but eventually everything was becoming a failure. Initially, I would say that those options were not working, and the cases were increasing, and the government was confused what to do initially. Then they decided to do a partial lockdown, and that created a bit of confusion and anxiety among the public. They were really rushing towards the supermarkets and eventually rushing towards the pharmacies, and they were concerned about their medication. They were totally concerned what to do in the case of lockdown, whether they're going to get their medicine, whether they're going to get their treatment on time, who would be the carer, who would be delivering their medication, whether they can come out, because obviously over 60s and over 70s they were at risk, and there were some more people who had some underlying problems. So there were so many issues that came, in the mind of public, and then when they decided to lock down completely, then our role started. That was the time when our role was really, really highlighted, because obviously then when everything was closed, and everywhere people were looking for some certain medicines and certain items, they were always thinking about pharmacies. So the major issue that we experienced initially was the stockpiling, and that was the public who was doing that. And in that case, the role of the public was not very good, I would say. They were trying to buy whatever was on the shelf. And this is something that I noticed, that when we say that British people, they are so nice and make it cute, they are so thoughtful about other people. At that time, unfortunately, I saw something totally different. They wanted to have everything, whatever was on the shelf. Can I have, for example, if we were selling them 1 or 2 paracetamol, can I have 4 of them? Can I have 5 of them? Can I have 6 of them? Like, can I have for my other child? Can I have for my neighbor? Obviously, they were panicking. I would say that they were not doing it on purpose. They were panicking that what to do and what's going to happen in lockdown. Probably the pharmacy is going to shut their doors as well. But that was the time when we had to reassure them, look, we are open. We're going to stay open. We are here for you. We will do everything possible for your health, and for whatever is better for you. We're going to do that, right? Okay. So in that case, we had to experience some, obviously, like as Hamad mentioned, that whatever the situation was in Canada, same thing happened over here, because obviously there is quite a lot of public who experience this shortage of bread, like asthma and COPD, things like that. So we struggled with some inhalers. We struggled with some antidepressants. Now you would be surprised to know that one of the very famous and one of the most common antidepressants, certainly we are out of stock of them. This is something literally we can't get hold of them, and there is very limited supply that we are having, and then obviously like some inhalers, a very common one like some beclomethasone, we can't get hold of them. So and then like soon they come, they goes out of the market because the supply issues are always there, and the handling was I would say that government has tried its best. In this case, I would say I would appreciate the government. They have tried their best to handle the situation with the supply issues, but unfortunately, because obviously the demand was there, so they couldn't handle it, like at the utmost. Now, when we move on to the, to your second question, which was about hydroxychloroquine and azithromycin, GPHC, General Pharmaceutical Council of UK, of England, I would say, they sent a letter initially. They circulated an emails throughout to all the pharmacists that if you have found anybody, any GP is writing down these medicines, please let us know, because it's unlicensed, it's not licensed in this country in this regard for COVID-19. So they strictly said that we are not going to issue antimalarials, we are not going to issue this azithromycin because it's a typical viral issue. And all people have to do is to follow our guideline, which is to take paracetamol in case if they think they have got COVID. They just need to gargle. They have to do social distancing. They need to isolate themselves. There were simple guidance that that were circulating all around the world. So obviously, but they strictly said that if you have found anybody, any GP who comes to you and you think that he is self-prescribed, or anybody you think that who was prescribed by by the GPs or by the doctors with these particular medications, please let us know, because it's not allowed, right? So they never, you can say, allowed these medicines on prescriptions, especially for this purpose. Obviously, it's allowed for, it's licensed for lupus and rheumatoid arthritis, but not for anything else. So in that case, we had no confusion, to be honest, and I never had any demand, and we never had any phone calls or anything, anybody who has asked, because we received so many phone calls about, like these symptoms, with some patients who were having those symptoms, which were clearly showing those symptoms of COVID-19, but we just had to tell them that, you have to stay at home, just make sure that you are simply taking paracetamol, gargling, steaming, as a frontliner, that's all you can do, but, obviously, I would say nobody ever pushed us for these medications, and I would say as well that this is partially due to the reason that some news came around in the world that these hydroxychloroquine and azithromycin, they causes cardiac arrest, and I don't know whether that could be a straight side effect or that person might have an underlying problem. So obviously that was not issued at all. Moving ahead towards your last question that was regarding healthcare professionals and the pharmacist, you would be surprised to know that I was told that I had COVID and I stayed home for 2.5 weeks for no reason. I'm telling you what was happened. Basically, a person just came into my pharmacy. He was bleeding overall. He was bleeding very badly, right? He came just next to me, standing like, I would say almost a meter distance. He was saying, I need something from your pharmacy. I said, well, you are bleeding, you had to be in A&E. In A&E, they are not looking after me. They're going to take so long over there, and I need something out from you. I said, okay, I'm going to give it to you. I just gave him some dressing and let him go, right? Okay. But I was feeling literally, I'm just experiencing this thing, something really personal. So I was literally a bit anxious, and I had a bit of shortness of breath, which I do experience sometime in the hay fever season. I rang my GP next day, and receptionist handled the call, and she said, no, if you are experiencing shortness of breath, you need to ring 111, which is our NHS service. I rang 111. I rang 111. They just said, okay, stay at home, but ring your GP again. I rang my GP again, and he said, yes, obviously, this is one of the symptoms of COVID, and you need to stay at home. From that day onward, I had to stay at home, and unfortunately, my condition got worse, and I had to ring the ambulance. When ambulance people came, I'm talking about 12 days after that incident. When ambulance people came, they said, unfortunately, we don't think so you had COVID at home, because you haven't had sore throat. And that's what I was trying to mention to the receptionist and even the GP, that I haven't got sore throat, I haven't got fever, persistent fever, I haven't got cough, The only thing I'm having is just shortness of breath, and that could be due to anything. But this was wrong diagnosis, and partially I would blame the GP surgeries who have shut their doors for the public. Here, the role of the pharmacist was paramount. Here, the role of the pharmacist was really great in UK, and especially in Europe and UK, I'm talking about. We were always there. I'm working now, I'm fine, I'm working now. But at that time, when I needed my GP the most, I needed some other healthcare professionals, they were all closed. But I'm still thankful to the paramedics who just came and just mentioned me this thing. They did my ECG, they did everything. They said, you just had a panic attack, that's it. Simple as that. So that's where the, like when we talk about the role of the pharmacist and healthcare professional, like in this pandemic situation, I would say pharmacists, they played a really vital role, right? And also, I'm going to say here that, our role was appreciated in the last by the governments. And I do appreciate Mr. Boris Johnson and some other people who appreciated, in particular, in their addresses, that the pharmacists have played a really, really vital role. And they are the frontliners, and they are the real fighters against this COVID-19. And even though I was a pharmacist, I was talking to some other pharmacists, my fellows. They were saying that, we don't know why you are sitting at home. I said, I was told to. I can't go out now. I was told to self-isolate. Because if I'm not doing it, then I'm just violating the law that I have been told. We know one thing, that the peak is here. More than 16,000 people have been died within this country. And it's going to run like this up to June, according to the government, statements that we can't ease the lockdown straight away. So in this situation, we have to doing our utmost to help people out in our pharmacies. Thank you, everyone. Thank you, everyone. And thank you very much for giving me this opportunity.
Right. Thank you very much, Shoaib and Hamad and Sheikh Saab again. And I'm just going to rephrase the questions now, because as some of them have been answered already. So if you could just share your experience with these hydroxychloroquine and azithromycin medication.
Assalamualaikum. Coming to your query regarding the use of HCQ and chloroquine phosphate, as I earlier mentioned, that these drugs are mainly used as an anti-malarial agent, but since the inception of this pandemic COVID-19, we are facing the issue of availability of these drugs. All of a sudden, these drugs disappeared from the market, and we had to struggle for the availability, to ensure the availability of these drugs for our hospitalized patients. In fact, many people approached me for the availability of these drugs to use for the prevention or the prophylactic dose or for the treatment of the remedy. But since that we have a very limited stock, so we usually discourage them. I want to share my own experience. One of the leading professor of medicine faculty approached me and called me up that I want to have some chloroquine phosphate strips, at least 6 to 7. Then I inquired, why are you demanding this 6 to 7 strips of chloroquine phosphate? Do you want to use on your patients? He said, no. Actually, I want to have a prophylaxis of my elderly parents. That I inquired, how old are your parents? He replied, they are above 70 and 75 years old. Then I humbly responded, do you know if they have any comorbidity, is it safe for them? Then he replied, they have comorbidity. And definitely, they have elderly patients. So they have some comorbidities of hypertensive cardiac issues. Then I humbly responded him regarding the use and possible side effects like cardiomyopathy, QT, interval prolongation, hyperglycemia, or associated risk with the use of these drugs. And then I explained him that this is not the choice of drug, or even not the prophylactic use of drug. This drug is now being under trial and is being investigated, but it's not proven to be effective for the treatment and prophylaxis of the COVID-19. He obliged and thankful to me. And since that, I have learned that this is the situation where we exist. Here, a pharmacist's role is very important and crucial. So, as far as me, I'm sitting in a hospital pharmacy. What about those who are sitting at community level? Our community pharmacists, or even our pharmacists physicians that please prescribe SCQ for the treatment and for the prevention of COVID-19. This is a malpractice. Ethically, I must say this should be discouraged at all levels. And here the responsibility of the pharmacist, the accountability is on the educate the caregivers as well. So this is the situation, and this is highly alarming situation. This drug should be used only in a hospital setting or against the prescription of the ID consultant or the critical care caregivers, doctors, and incentivists. So we should discourage the overstocking at pharmacy stores level. Unfortunately, we live in the part of the region where every crucial drug available on over the counter, and no one is asking for the prescription while dispensing any sort of drug. So it can easily be accessible to anyone, and people don't know where the side effects affiliated with this drug, and the overuse and misuse of this drug may consequences lethal to them. So this is the shared responsibility of everyone, rather we as a hospital pharmacist, community pharmacist, and I'm sure unfortunately, with the inception of this COVID-19, everybody is prescribing azithromycin as a drug of choice, and everybody is assuming that this is the only remedy for the prevention and for the treatment of this COVID-19. We had experienced the same since last 4 years, where we witnessed that this is the only drug of choice for the MDR typhoid strain. And since the time we are using extensively, even our GPs are prescribing this as a remedy for the upper respiratory tract infections. And this is now very common among our population. So might be possible there is a risk of increased resistance against these antimicrobial agents by the time, and we have end up the situation where resistance develop, and we haven't any choice in the near future. So this should be, our pharmacist has a responsibility to educate people, to educate without having a proper valid prescription. So this should be a question coming forward to your third question, that was regarding the breakthrough achievement or significant achievement of the Dow University Hospital against the fight of COVID-19. Actually, this came into my knowledge through media. In fact, though I'm part of DUHS, our research team under the leadership of Vice Chancellor Professor Saeed Qureshi has prepared IVIG immunoglobulins obtained from the plasma of recovered patients of coronavirus patient. And the intention of to use these antibodies for the treatment of COVID-19. They have conducted animal studies successfully, and they are claiming this is a very highly effective, safe, and easiest way to transfuse these antibodies to patient, and they are in a plan to strategize the clinical trials after the proper ethical and regulatory requirement management. I feel this is a major step towards the passive immunization, as because these are antibodies extracted directly from the plasma of the recovered patient, in contrast to transfused whole plasma, where the risk of probable pathogens, viral or bacterial, and plasma proteins are there. So this might be very effective and safe way to treat those patients. I'm sure, I'm hoping so I must say that this is not only the hospital pharmacist's responsibility, this is the responsibility of every healthcare worker, including pharmacists, physicians, paramedics, everyone. And we being pharmacists, this is our responsibility to at least educate our people, to disseminate the information that yet now there is no proven to be effective treatment or prevention of COVID-19. Around the world, there are, as per my knowledge, there are 42 clinical trials are underway, and they are trying to investigate the exact vaccine or the treatment protocol for the COVID-19. Inshallah, I'm hoping they will be successful within few weeks or months, inshallah. With this, I would like to say thank you for giving me an opportunity to present my views and my thoughts. Thank you.
Thank you very much for highlighting yet again the problems with offering treatments to patients who are not supposed to be offered that treatment. Allow me to move to our last speaker, Arif Ali Rai, who's the manager at Indus Hospital. And he's been working in hospital and community pharmacy for the last 15 years. Now, Indus Hospital was one of the first hospitals that volunteered in Karachi to take COVID-19 patients in non-public sector. So my question to you is that were there any specific SOPs taken to encounter this pandemic when the hospital administration chose to volunteer itself to take COVID-19 patients first? And if you could just kindly add on to that question, what was your biggest challenge that you faced as a frontline pharmacist?
Thank you for it. Yes, the hospital administration already planned in the January month of January to planning to develop the COVID unit in the Indus Hospital for in the future, for future patient load. Then the pharmacy will align with the management, and we have make some SOPs according to the requirement of this pandemic. We in the as a pharmacy frontline healthcare provider, we have make sure to infection control standardize SOPs to implement to all over the healthcare hospitals, as well as we limited our staff to in the scheduling point of view to minimize the exposure, as well as we have developed the one satellite pharmacy in the COVID unit specific to minimize the other pharmacy team to explore the COVID related patients, as well as the pharmacy also we are facing some major medicinal product as well as PPE. That is the biggest challenge currently for us. I would like to appreciate my supply chain team. They are make suring and availability of the PPE material in my institute, as well as we are facing regarding the sanitizer hand rub in the also in institute. We the pharmacy team we develop the hand sanitizer solution as compounded product as per the guideline of WHO.
Right. Thank you very much. So yes, so we see an example here of an institute that proactively kind of got itself prepared. And so, I mean, summarizing all of it together is actually to be a difficult task. They say the speakers are talking about the irrationality of the usage of hydroxychloroquine and azithromycin. Like Asma mentioned, you yourself mentioned, Hamad, and even Shoaib mentioned a bit. The question says that it was a decree was issued in France to have the sufficient storage or the stocks for the hydroxychloroquine and azithromycin, and similarly other countries took certain initiatives, you know, and gave out certain circulars saying that okay, it could be used in certain conditions. Now, if you allow me, I can actually kind of answer that from the French perspective because it was the French study that started everything all around the world. And so yes, there was a decree that that said hospitals are allowed to use it under the monitoring of a consulting physician, as Dr. Asma clearly said. So yes, you could use it. There are a lot of anecdotal evidences that it has worked for a few patients, but yes, you can use it in a hospital under the supervision of the consulting physician. The prescription that can be given to that patient also needs to come from the same physician, so that the chances of any adverse reactions are minimized in this matter.
Farooq, sorry, Farooq, I just wanted to add up one thing into that. I've heard one hospital in Liverpool who are giving this azithromycin so that they can avoid any type of secondary bacterial infection. So they are giving azithromycin. This is one of the doctors I have spoken to, and they said yes, they are giving azithromycin, but it's again, as you said, that it's in hospital environment. They are not giving to the member of public straight away.
Sheikh Saab, did you want to make a comment that you wanted to make? You can make it now, please.
Is it a comments or I just can't make it? What I was really coming about was that if I look at it in totality, what we've been talking about, you start from France, you look at UK and you can Canada, and then you come to Colombia and then eventually to Pakistan. I think there is one thing which is coming absolutely clear, that the pharmacist as a frontline healthcare worker in any working environments, their role, their commitment, and their professionalism has been proven beyond any doubt. That's one thing which is coming out of this symposium, this webinar. The second thing is, when you look at it, this spectrum of the countries, you will definitely see that there are certain very peculiar kind of a challenge. And one of the challenge I would put on the table in front of all my pharmacist colleagues is that, what has happened with the hydroxychloroquine and chloroquine. In some parts of the world, these drugs might not have been as readily available, and the community pharmacies setup is very well structured. So there is always a check and balance. But the pharmacist in this part of the world, when I say this part of the world, I mean, let's say in Pakistan or other developing countries where the medications are mostly available over the counter, I think the pharmacist has a daunting challenge to how do you ensure the patient's safety in a situation like that. And I think that one area where the regulatory bodies in this part of the world, they have to come up with some oversight of it, that these drugs are not really sold over the counter, whereas most of the medication in this region and this part of the world, they really are sold over the counter. And I think one of the things which you earlier referred to was antimicrobial resistance, and I think one of the major contributory factor really is even in that, if you are having these antimicrobial exchanging hands, on over the counter. So the challenges are there. One of the challenge which I think which ran across all the continents was the shortages of medication, availability of PPE, and the other perhaps challenges are which are very peculiar. For example, our colleague Schwab had mentioned some of the specific challenges in UK, and there were some specific challenges in Canada. But I think in the developing world, the challenges still would remain to be the lack of a robust community pharmacy practice and an oversight of safe use of medication in this region. And I think I'll conclude with these comments. And then I want to thank you, particularly all the panels. I think this goes to show that this should not be the only webinar of its kind, because there are major challenges globally, and I think we should be more forthcoming with these kind of webinars, hopefully in the future. And thank you very much. I thank you, each one of you, and thank the panel. They have done a tremendous job, and I personally do appreciate that. Thanks a lot. Thank you.
Pharmacists, despite the fact that these are unprecedented times that any of us has ever kind of observed or even had a chance to study during our school days, pharmacists remain aware especially in countries where community pharmacy and hospital pharmacy is more established, they remain the most trusted and accessible resource despite all the lockdowns and everything to the general public. And especially their importance is far much greater in the time of pandemic. This genesis of COVID-19 pandemic, it occurred only less than 4 months ago. And our knowledge as a community about the disease is changing daily. We don't know enough about the disease and we don't know enough about the treatments. So obviously pharmacists have a key role to play as drug information experts, synthesizing and communicating the best possible information, whatever is available, obviously, and evaluating the literature to the best for our patients. I once again, at the end, thank the organizers, PharmEvo, for this amazing initiative of bringing in pharmacists together, because we've been hearing all the different other healthcare professionals talking about different topics at multiple channels. But having this opportunity for the pharmacists, by the pharmacists, is absolutely amazing. And I want to thank our session chair, Abdulatif Sheikh Saab, for his commentary and kind of vision for what can be taken away from this time of pandemic. Also, Hamad from Canada, Shoaib from the UK, Dr. Angela from Colombia, Arif from Pakistan, and Asma from Pakistan as well. And last but not least, to all the listeners, who've been part of our session, our fellow pharmacists, physicians, nurses, all the healthcare professionals. Further seminars after this one on similar or slightly different topics in order to benefit. Thank you very much, everyone, and have a good day.